endogenous catecholamine, and sympathomimetic. Provides vasoconstriction, chronotropy, enotropy, dromotropy, and bronchodilation. Does a lot of different things. Cardiac arrest dose, we're going to use every 3 to 5 minutes for the duration of the cardiac arrest. And we're giving 1 milligram IV IO, and this is the 1 in 10,000, the more potent concentration. It's used in shockable and non-shockable arrest rhythms. So ventricular fibrillation, if it's shockable, shock, immediately begins CPR. We're doing compressions. We're trying to perfuse, defibrillate once that becomes an available option. We want to also make sure we gain IV and IO access. For epinephrine, 1 milligram, 1 in 10,000, we give 3 to 5 every 3 to 5 minutes. In refractory VFib or pulseless VTAC, rhythms sustain after 2 defibrillations. We're going to give amiodarone, 300 milligrams IV push, and then amiodarone 150 IV push. Monitor H's and T's. Lidocaine. What does lidocaine do? So lidocaine, you probably had it at the dentist if you've ever had to get mouth anything. It's also an antidysrhythmic, used for ventricular fibrillation or pulseless ventricular tachycardia. So we're going to give 1 to 1.5 milligram per kilogram, that's IVIO, for the first dose. 0.5 to 0.75 milligram per kilogram. This is a little more of a, you got to memorize this dose compared to the other ones that are kind of like just 1 or 10 easy numbers. So 1 to 1.5 milligram, 0.5 to 0.75 milligram per kilogram. So imagine you're just cutting it in half for the second dose. If needed, max dose of 3 milligrams per kilogram. If conversion, start an infusion of 2 to 4 milligrams per minute, 1 milligram higher than the converting dose. For stable ventricular tachycardia with a pulse, SVT, we're going to give 1 to 1.5, 0.5 to 0.75, same as before. Conversion, I guess all of this looks like it's the same, except if conversion, 0.5 milligram per kilogram, IVIO in 10-minute increments of 2 times. ACLS medication, we have nitroglycerin. This is a potent vasodilator. Indications would be chest pain, obtain a 12-lead first, and establish our IV access. If we have pulmonary edema, we want to administer CPAP to help with evacuating the fluid from the alveoli. It's going to force the fluid out. Dose 0.4 milligram 3 times every 3 to 5 minutes is needed. 1.2 milligram max of our total dose. Yeah, so the sprays that we have are 400 micrograms or 0.4 milligrams. We don't want to go too far because we don't want to bottom out their blood pressure and dilate it too much. Monitor blood pressure with each dose. Don't administer with systolic blood pressure under 100 millimeters Hg. Some protocols can vary. So yeah, obtain IV access, 12 lead. Nitrobid is the paste form, and apply a 1-inch circle, 15 milligram TD, upper left chest. Interesting. Upper left chest. That's cool. I didn't know that. It doesn't even say the most important part. So our contraindication would also be if they were taking sex performance enhancing drugs such as Levitra, Cialis, or Viagra. If they're taking that at all, if they took it within the last week, some protocols would say 3 days, but just be wary of that if they've taken it. Procainamide, Pronestil. Antidysrhythmic, blocks the influx of sodium, slows conduction, decreases both atrial and ventricular rates. We're going to consider it for stable tachycardic rhythms over 150 beats per minute of SVT, VT, AFib, and we want to make sure that we give 25 to 50 milligrams per minute. So for stable VTAC, amiodarone 150 milligrams over 10 minutes, or procainamide 25 to 50 milligrams per minute. Or we could give solutol, 100 milligrams. What is the next one? Solutol. Sodium bicarb, cardiac arrest for known dialysis patients or prolonged downtime of 1 m per EQ per kilogram IVO access, or 8.4%, to be simple. It's good for tricyclic antidepressant overdoses as well. May cause transient increase in capnography. So sodium bicarb is a basic or alkali to combat not diabetic, but if someone has too much acid building up, if the cells are tearing apart and causing a bunch of toxicity, and the blood is becoming more acidic because there's not enough oxygen, there's too much carbon dioxide and other compounds building up, that's what sodium bicarb is going to combat. Solutol, 100 milligrams, good for stable tachycardic rhythms over 150 beats per minute, SVT, VT, AFib. So 150 milligrams, and then procainamide or solutol. Review questions, cardiology review. All right, we're in the nervous system.